Good morning, everyone. Today we will talk all about newborn screening. This report is made through the collaboration of Group 5 members, namely Ms. Ignacio, Ms. Serrano, and yours truly, Belaran. First, let us take a look at the overview of everything that we will discuss for this morning. What is newborn screening? The vision, mission, and goal of the newborn screening program. When does newborn screening happen? Frequently asked questions before newborn screening. Newborn screening activities which include blood spot screening, pulse oximetry screening, and hearing screening. Why screen your baby? And lastly, expanded newborn screening panels. Now, what is newborn screening? Newborn screening identifies conditions that can affect a child's long-term health or survival. It is done as an early detection, diagnosis, and intervention can prevent death or disability and enable children to reach their full potential. It enables the early detection and management of several congenital disorders, which, if left untreated, may lead to mental retardation and/or death. Basically, it is a simple procedure to find out if a baby has a congenital metabolic disorder that may lead to mental retardation or even death if it is left untreated. So, NBS is also the most successful genetic screening program in the Philippines. It started as a research project in the Philippines in 1996. Then it was mandated by law in 2004 as the Republic Act No. 9288. Also known as the Newborn Screening Act of 2004, with its implementing rules and regulations. In 2014, the National Comprehensive Newborn Screening System has expanded the screening panel of disorders from 6 to 28 and more disorders pursuant to the Department of Health Administrative Order No. 2014-0045, or the Guidelines on the Implementation of the Expanded Newborn Screening Program. Let us also tackle why it is important to screen your baby. Now, most babies with metabolic disorder look normal at birth. One will never know that the baby has the disorder until the signs and symptoms are manifested. By this time, irreversible consequences are already present, and by doing the newborn screening, metabolic disorders may be detected even before clinical signs and symptoms are present. As a result of this, treatment can be given early to prevent consequences of untreated conditions. And of course, it is important in reducing newborn morbidity and mortality. Next, we'll move on to the vision, mission, and goal of the newborn screening program by the Department of Health. The vision is that every Filipino child will be born healthy and well, with an inherent right to life, endowed with human dignity and reaching his or her full potential with the right opportunities and accessible resources. The mission is to ensure that all Filipino children will have access to and avail of total quality care for the optimal growth and development of their full potential. The goal is by 2030, all Filipino newborns will be screened and properly managed for common and rare congenital disorders to reduce preventable deaths of newborns. Also, the program objectives is by 2030, all Filipino newborns are screened to strengthen the quality of service and intensify monitoring and evaluation of MBS implementation, a sustainable financial scheme, and to strengthen patient management. The target population is the Filipino newborns, and the area of coverage is nationwide. The policies and laws included in this program is the RA 9288, or the Newborn Screening Act of 2004, and also the DOH Administrative Order No. 2014-0045, or the Guidelines on the Implementation of the Expanded Newborn Screening Program. Now, when does the newborn screening happen? It is usually done 24 to 48 hours or 1 to 2 days after birth, but not later than 3 days. If the baby undergoes NBS earlier than 24 hours, they should be retested. This is because some disorders are not detected if the test is done earlier than 24 hours from birth. If the baby is born early or premature, or is needed to take medicines and nutrients, the NBS should be more intensive, or the baby should undergo further testing. If the baby undergoes transfusion of blood or dialysis, the NBS can be done later on. And according to Article 3, Section 6 of the RA number 9288, a newborn placed in intensive care unit in order to ensure survival can be exempted to the 3-day span requirement, but must still be tested by 7 days of age. Now let's head on to the frequently asked questions about newborn screening. The following are potential questions that parents ask a medical professional who is handling their baby for screening. By answering these questions, it will help relieve the stress and worry of the parents during the screening. First is, will I need to ask for my baby to be screened? No, you don't need to, because with the support of the DOH and the President of the Republic, and also a 2004 congressional mandate to ensure that every baby born in the Philippines is offered the opportunity to undergo newborn screening, and it is also stated in Section 6 of the RA 9288, that any health practitioner who delivers or assists in the delivery of a newborn in the Philippines shall, prior to delivery, inform parents or legal guardian of the newborn of the availability, nature, and benefits of NBS. Next, when does NBS happen? Again, it is ideally done immediately after 24 hours of birth. Third is, can I be with my baby during screening? Actually, parents are welcome to be a part of this process by holding their baby. Studies show that when mothers or health professionals comfort babies during this process, the babies are less likely to cry. Next is, how are the costs of newborn screening covered? The expanded newborn screening costs about 1,750 pesos, and it is included in the Newborn Care Package or NCP for PhilHealth members. Next is, for what conditions will my baby be screened? There are 5 disorders that are tested for the newborn screening, but with the current expanded newborn screening, more disorders were added and are now 28 plus disorders. These will be further discussed later on. Next is, what options do I have for NBS? As stated in Article 3, Section 7 of RA 9288, or refusal to be tested, the parent or legal guardian may refuse to let their baby undergo newborn screening according to their religious beliefs. However, there must be an acknowledgement or a refusal form which indicates that they are refusing their baby to be tested. Moreover, it is mandatory that all acts included in newborn screening be performed, but the parent or legal guardian may have an option which act to choose first unless the doctor requires that all be taken simultaneously. Still, what will happen to the baby is up to the physician. Also, families can make requests for additional screening, also known as supplemental screening. Additional screening refers to extra testing that can be performed after participating in your state's newborn screening program. This is sometimes done if there is family history of certain conditions or other health concerns. While each state screens for many conditions, there are more conditions that can be detected at birth. But this action needs to be discussed with a healthcare professional since not all conditions are covered in all states and are provided. The insurance company must also be contacted since this is only a follow-up. Also, they have an option with what happens with their baby's blood spots after NBS, but usually after the dry blood spot has been tested, it will be stored in a secured locked area. Next is, how long will it take to get my baby's results? The results can be claimed from the health facility where ENBS was availed. Normal ENBS results are available by 7 to 14 working days from the time samples are received at the NSC. The positive ENBS results are relayed to the parents immediately by the health facility, so make sure that the address and phone number that you'll provide to the health facility are correct. Next is, when will the results be in my baby's medical chart? It can be seen in the medical chart after the results are out, but it still depends on which result is done first or if the test is negative or positive. Because if it is positive, then it might need a bit more time to conduct further testing. Next is, what will happen if my baby's tests are out of range? An out-of-range test result means that further evaluation is needed to know if your baby has a disorder. Sometimes this means that another specimen is needed. Sometimes this means that the baby will have to be seen and tested by a specialist within a few days. And sometimes it means that the baby should be seen by a specialist as soon as possible. Your baby's doctor will let you know what is recommended. But note that premature or low birth weight newborns are more likely to have out-of-range test results on the first specimen, even if a disorder is not present. Also, there are times when NBS shows that a baby might have a condition, and further testing reveals that the baby does not have a condition at all. This is called a false positive result. Healthcare providers usually determine false positive cases during follow-up testing. Now let's move on to the newborn screening activities. First is the blood spot screening. The blood spot screening determines if the baby might have one or many serious conditions. It is also known as the heel stick or 24-hour test. It was known as the PKU test, but is no longer accurate since the MBS today check for many conditions. Now there are guide steps, and it is done between 24 to 48 hours after birth. And the baby is swaddled during the procedure while gently warming their feet or heel to induce blood flow to make the process much more easier. And then the healthcare provider will give the baby a quick prick that might make the baby cry, but it will not leave any marks. The healthcare provider will get a few drops of blood and place it in a card. The card has two sides, the side where there is a circle and has a filter that absorbs blood, and the other who has the information of the baby and tells whose blood that is. Now once the blood dried up, it will be sent in the laboratory. It will be done and ready for 5 to 7 days, and just wait for the updates from the healthcare provider since the results it will not be sent straight to the parent, but ask for the results in the first or second visit if there was no update after 7 days of waiting.
Pulse oximetry screening determines if a newborn might have certain heart conditions. Sa pulse oximetry screening po, ina-estimate po dito yung amount ng oxygen sa blood ni baby. Kung low level of oxygen yung blood ni baby, that might be a sign po of coronary heart disease. Example, critical congenital heart disease or CCHD, which is a group of serious heart conditions present at birth that arise when parts of the heart do not form correctly. The heart has trouble delivering oxygen from the lungs to the rest of the body. Thus, babies who has this kind of illness needs to be examined immediately. So, parang tulad nga po ng sinabi ko kanina, kailangan i-pulse oximetry screening si baby para malaman yung level ng oxygen sa blood niya. Para malaman yung kung meron siyang mga tulad ng ganitong conditions. Hearing screening. Hearing screening po determines if a newborn might be deaf or hard of hearing. Baby starts to talk at 1 year old. Newborn might not be able to, but based on what they hear. Babies with problems in hearing or have hearing loss may start slow learn to talk. There are 2 types po of hearing screening. Ang una po ay auto-acoustic emissions or often called OAE. This OAE procedure po is where healthcare provider puts small buds in baby's ear. Ipapatunog po yun ng soft and gentle sound, and yung computer po yung mag-measure kung paano nag-expand ang ears ni baby. If the baby is able to hear, then the computer can detect a response and vice versa naman po. Pag walang response, then walang detection. Sunod naman po yung pangalawa ay automated auditory brainstem response or often called AABR. Dito naman po, sa procedure na to, maglalagay sa ears and sa head and sa neck ni baby ng band 8 like sensors. Then, magpi-play po ng soft sound or clicking sounds and tones, and yung electrodes po ang magme-measure how the hearing nerves and brain respond to the sound. If si baby po ay na-pass ang test, then probably po si baby ay may difficulty sa pandinig or worse, siya po ay deaf. If failed po, si baby po is in need to refer to a specialist to be able to evaluate po ng mas maigi. So, why screen your baby? Screening your baby is a must for us to know if there's any case or deficiency and conditions that your baby need to be treated. Disorder screen are the CH or congenital hypothyroidism, affects not screen, severe mental retardation, effective screen and treated normal. CAH, congenital adrenal hyperplasia, death, alive and normal. Galactosemia, death of cataracts, alive and normal. PKU, phenylketonuria, severe mental retardation, normal. G6PD, severe anemia, kernicterus, normal. Expanded newborn screening panel. The expanded newborn screening panel increased the screening panel of disorders from 6 to more than 28. Done immediately after 24 hours after birth. May be collected by any of the following: physician, nurse, medical technologist, or trained midwife, and available in hospital, lying-ins, rural health units, health centers, and some private clinics. So sa newborn expanded screening po, tinetest din po dito yung endocrine disorders. Isa po dito yung congenital hypothyroidism or CH, metabolite tested thyroid stimulating hormone. So sa congenital hypothyroidism po, nag-occur po ito when yung thyroid gland ay nag-fail na mag-develop or may function. So, yung symptoms po nito ay yung jaundice or yung paninilaw ng skin or eyes, large swollen tongue, poor or slow growth. Next naman po yung congenital adrenal hyperplasia. From the word hyperplasia po means meron pong abnormality sa pag-increase ng number of cells that make up an organ tissue. Ito rin pa isang genetic disorder that affects the production of certain hormones. Effects is not screened. Severe mental retardation and death. Effects of screen and manage. Normal, alive. Next naman po ay yung amino acid disorders. Ito po yung homocystinuria, hypermethanoianemia, or methionine adenosine transferase deficiency, maple syrup urine disease, phenylketonuria, tyrosinemia type 1 and tyrosinemia type 2 and 3. Ito naman po yung effects is not screened. Mental retardation, coma, and death from metabolic crisis. Effects naman po of screen and manage, alive, normal growth, normal intelligence for some, and learning problems to others. Next naman po ay yung fatty acid disorders. So, ito po yung mga disorders na mga nasa table. So, ito po yung effects is not screened. Developmental and physical delays, neurologic impairment, sudden death, coma, seizure, enlargement of the heart and liver, muscle weakness, crisis. Effects of screen and manage, usually healthy in between episodes of metabolic crisis and alive. Next po ay organic acid. Sa organic acid po, ito rin po yung mga nasa table na nasi-screen po. So, effect is not screened, developmental delay, breathing problems, neurologic damage, seizures, coma, early death. Effects naman po of screen and manage, alive, most will have normal development with episodes of metabolic crisis. Urea cycle defect. So, urea cycle po ay caused by a specific deficiency of one of the normal expressed enzymes of the urea cycle. So, yung urea cycle disorders are a group of inherited conditions of amino acid and metabolism. So, yung example po nito ay yung citrullinemia and argininosocinic aciduria. So, early diagnosis and treatment are essential for an improved prognosis sa defect na to. So, if left untreated, infants with these conditions will suffer progressive neurological deficit and death. So, effect is not screened, seizure, mental retardation, and death. Effects of screen and managing, alive, and normal intelligence. So, next naman po ay sa hemoglobinopathies. So, babies with hemoglobinopathies do not make enough healthy red blood cells. So, in that case po, yung mga babies nagkakaroon ng conditions like these examples po. Alpha thalassemia, beta thalassemia, hemoglobin C, hemoglobin D, hemoglobin E, and sickle cell disease. So, yung mga effects is not screened, painful crisis, anemia, stroke, multi-organ failure, death. So, yung effects of screen and manage, alive, reduces the frequency of painful crisis, may reduce the need for blood transfusion. So, yung others naman pa galactosemia, glucose 6-phosphate dehydrogenase deficiency, cystic fibrosis, biotin-based deficiency. So, yun lang po. So, yung mga references po namin ay manananggaling po dito sa Center for Disease Control and Prevention, Department of Health, Why Screen Your Baby, Health Resources and Service Administration, Newborn Screening References Center, Basic Information about Newborn Screening, and Newborn Screening Reference Center Expanded Newborn Screening Panel Retrieve. And yun lang po. Thank you.